This afternoon's session, do we need to eat plants? And whoa, hold your horses. Now, let's slow down. Now, I'm going to introduce the chair, and our wonderful chair is going to lay some ground rules, okay? So, and we're ruling with an iron fist here. So, a GP in the southwest of England, he has a special interest in metabolic health. Dr Murdoch is also a quality improvement clinical advisor and trainer for the NHS Sustainable Improvement Time for Care programme, and a clinical advisor and entrepreneur for the Royal College of General Practitioners. Please welcome Dr Campbell Murdoch.
Thank you very much. That was a couple of years old, that bio, so that's changed slightly, but it's on the right theme. Afternoon, everyone. Real pleasure to be with you all. So this session is focused on plants in the diet and do we need to eat them. Why I'm passionate really about this particular session today is I am a GP and I see probably getting on for 100 or so patients a week. And there's this very important concept we now have called shared decision making, which shouldn't be a new concept, but it is. And that's basically people receiving the information they need that they can make sense of to be able to decide what's best for them and their health. This, obviously, we've heard that nutrition is extremely important for our diet, and plants are often a significant discussion point with diet. So we have a fantastic panel this afternoon, and I'm just going to run through names and bios. So you have Dr. Hayley Wood, who flew in from Ireland and got to bed about 2 o'clock last night. So thank you very much, Hayley. So Dr. Hayley Wood came the long way around to medicine after a colourful collection of other studies, work and travel. She graduated in the UK in 2008, then spent 5 years working across various medical specialties in South Africa. Circumstances brought her to Ireland in 2014, where she accidentally fell into psychiatry. Hayley now works in CAMS, which is the Child and Adolescent Mental Health Services, in the west of Ireland. She strongly advocates a whole-person approach, incorporating diet and lifestyle strategies towards mental and physical health and well-being. Next, we have Dr. Chidi is joining us. Thank you very much, Dr. Chidi, on Zoom up on the screen there.
Hello.
So Dr. Chidi is a leading lifestyle medicine doctor with a background in surgery and general practice, having studied medicine at Cambridge and Johns Hopkins. He has lectured at many institutions, conducted a TEDx talk, and provided expert advice to media programs. He has set up award-winning restaurants, the award-winning restaurant Plant in London, and is an ambassador for Plant-Based Health Professionals UK. So welcome, Dr. Chidi. Next we have Patrick Holford. Welcome, Patrick. Patrick has been a leading figure in nutrition since 1984. I was 4 years old then. He was a founder of the Institute of Optimum Nutrition to train the first generation of nutritional therapists. He now helps people transform their lives through health retreats and is a trustee to the Food for the Brain organisation specialising in dementia. Welcome, Patrick. Next we had Anthony Chaffee. Welcome, Anthony. You are zooming in from Australia?
Yeah, from Australia.
Fantastic. Thank you for joining us.
No problem. Thank you.
So Anthony is a US medical doctor who for the last 20 years has been researching optimal nutrition for human health. He started university at the age of 16, studying molecular and cellular biology, before some years of professional rugby in the USA and UK and volunteering at the refugee camps of Bangladesh. He is now resident in Australia and practicing functional medicine alongside neurosurgery. So welcome, Anthony.
Thank you very much.
And we have on my right, Shawn Baker. Welcome, Shawn, Dr. Shawn Baker. So Shawn is a co-founder and chief medical officer at Revero, having spent years as a chief of orthopedics in the US military. He has conquered many athletic endeavours across indoor rowing, rugby, strongman competitions and Highland Games. He is best known for introducing the zero-carb elimination diet to the nutrition world and is the author of the best-selling The Carnivore Diet. So, we have choices with what we eat in our lives and what we decide to eat. And the PHC, as everyone probably here knows, is a real advocate for real food and therefore the reduction of ultra-processed food. And the promotion of metabolic health within that. Now, outside of that, there are obviously a huge number of choices that people can make with their diet, and there are a number of reasons they may or may not make choices to eat certain foods. And there's a lot of diversity. So this obviously includes the role of plants in our diet and in our health. This session, we're going to explore this in some detail, and I'm going to set some ground rules in a minute because it is an emotive topic for people, and people do come with preconceived ideas and opinions and facts. We're going to try and loosely base it around 3 themes, just to try and keep some coherence to the conversation. So evolution, saturated fat and fibre. Equally, I've said to all the panel that we can kind of see where the discussion goes on those points because everyone has their own expertise, but we'll try and keep it coherent. The ground rules are, it is an emotive topic and we shouldn't ignore that fact. Everything to do with nutrition seems to be emotive, but especially when you start talking about plants, it increases that emotion. So it's really important we can hear different opinions and perspectives, especially around this concept of shared decision making. But to make that possible, it has to remain respectful. My job is to try and ensure fair use of time. I don't know what my skill will be like doing that, but I will try and encourage everybody to get a fair input. Opinions and facts are absolutely fine, but we're going to try and push to make sure we understand when something's an opinion and when it's a fact, and try and push for the evidence behind that and get the clarity on that. And as I mentioned, we're going to stay on task. We are not talking about ethics or the environment in this session. The next session talks about environment, so we're not talking about those things, but we will sort of more sticking to, I guess, biology, health, and I guess some personal journey behind that. So without further ado, we're going to start with you, Hayley. Actually, no, we'll go with you last, shall we? Do you want to go with you last? Okay, fine, sorry. So Dr. Chidi, if you're happy. So the format of this is going to be about 10 minutes or a little over for each person to present their perspective and case and thoughts on the topics. Then after about an hour, we will have a maybe 1-2 minute break, and then we'll have more of a discussion around those topics. I do want to try and include some Q&A from the audience. So I just downloaded the app, but maybe looking at Olivia or Sam to help prompt when questions come up to help the conversation. So without further ado, Dr. Chidi, please present your 10 minutes.
Well, thank you very much. It's a privilege to be talking to you all. I wish I could have been there in person, obviously. I've never been to Sheffield or the Crucible, but maybe next time. Yes, as has been said, I'm Dr. Chidi. My background is really in really reversing disease. Oh, I guess I should play this. Hold on, where did hold on. Let's play it. I guess my background is in reversing disease. That's what I'm known for. That's what I do most of my work on. These are some contact things if you need to get in touch with me. I have this program. It's called Life Colors, and it really demonstrates how we can reverse or prevent many of these big diseases that are ravaging, especially the Western world. But I guess I'd like to just go back to, I like to call it the heart of the matter. I was privileged to study a lot of my medicine at Cambridge, and I did my surgical rotation at Cambridge. And in my surgical rotation, I spent 6 months at Papworth Hospital, world-leading cardiac hospital, brilliant people there. And I would spend probably 2 out of the 5 days of the week doing 3 coronary artery bypass grafts a day. I mean, heavy work, intensive work. But I'd always remember one day when we were in clinic, I had a guy come in who had had a graft before and needed another one because his arteries had furred up again. And the professor sitting next to me said, well, look, mate, you're too sick. There's nothing we can do for you. And we let that man walk away. Within 3 months, he went home and he had died from his heart disease. We couldn't do anything about it. I thought to myself, well, surely there's something we can do. And I looked into it and I realized that there was. And I came across this gentleman, Esselstyn Caldwell, in the States, similar to me, background in surgery. And what did he do? He took a load of people who had severe cardiac disease and he put them together. And all he did was transform their diet into a healthy plant-based diet. Very little oil, no animal fat, no milk, anything like that. These people who had severe coronary artery disease, most of them had no further events. What I mean by that is no chest pain, strokes, angina attacks or anything like that for the 11 years after the experiment. And again, all I'll say to you is that all he did was change their diet. And in some of them, and you may have seen these angiograms before, these are the angiograms where you look into you pour some dye into the arteries and you look at the architecture of the heart, you can see that the disease had been reversed. Now, when I was doing cardiothoracic surgery, if I presented this to my colleagues and said, well, look, this is the before and this is the after surgery, they would say, fantastic, Dr. Chidi, well done. But this before and after, we can see the kink in the artery before and the opening of the artery after, that is just from a change in diet. Yes, it took a few months. I think the 18 months in between, but I would much rather do that than have my chest opened by a surgeon like me. Related to heart disease in terms of blood pressure, we know that as you digest greens, it goes into your bloodstream, it causes those arteries to open up. It causes them to open up because you have this chemical nitric oxide that the greens will help liberate into your arteries. This nitric oxide, by the way, is the same ingredient for Viagra. It's the active ingredient. And people say to me all the time, yes, Dr. Chidi, I want to lower my blood pressure, but don't give me any of this rabbit food. I don't want any of that rabbit food nonsense. Well, if there's one thing we know about rabbits, they don't need Viagra. I will move on. What about this? Look, I mean, one of the biggest studies in human health, the biggest studies, the premier of China, he was dying at the end of the 1970s of cancer, liver cancer. He did one great thing. He said, look, let's find out, why are people dying from liver cancer or cancer at all? And given that it was a totalitarian state, he did a survey throughout the whole of China. And because it's totalitarian, everybody had to answer. Pretty good for research, not so good for freedom. But over 880 million people had to answer this survey about cancer. And what did they discover? That adjacent places in China had very high levels of cancer and some places had very low levels. It couldn't be genetics, not the water. What was it? Well, they discovered that the richest parts of China, who could actually afford the meat and the dairy and the sugar and all these things and the processed stuff, well, those were the ones who were dying most from cancer. They had cancer rates a bit like we have in the West, about 1 in 3, 1 in 2. Whereas the rural Chinese, who couldn't afford any of that, all they could have is vegetables and rice. They had hardly any incidence of cancer at all. In fact, the figure that was quoted, they had 1 in 100,000 people had cancer compared to the 1 in 3, 1 in 2. So there's something going on with this plant-based living. And obviously this, we always like to talk about research, but I like these population studies because they tend to tell us an awful lot more about what's going on with millions of people. And when you look at the world and the levels of animal fat intake, comparing that with age-related breast cancer, you can see the correlation that down in the lower left corner, El Salvador, Thailand, low amounts of animal fat, low amounts of breast cancer. Go all the way up to places like the UK, Denmark, New Zealand, high levels of animal fat, high levels of breast cancer. This isn't really a coincidence. There is an absolute link. And the one thing that we showed from the China study, and the China study is not just one study, it's thousands of studies. The biggest thing that came out was that the more meat and dairy in your diet, the greater your risk of cancer. Now, the people that were doing the experiment, they didn't even believe it because they were heavy meat and dairy proponents themselves. They had to do another experiment where they took aflatoxin, injected that into a whole strain of mice. That causes liver cancer. Okay, and then they did, and all of them died from liver cancer. The next time they did a new strain of rats, injected them with the aflatoxin, but reduced the amount of dairy and meat in the diet. Very few, if any of them, got cancer. There is something going on with the meat and dairy in our diets. I mean, many of you probably already know the research out there saying that if you have certain amounts of red meat in your diet, it increases your risk of bowel cancer. But it's lots of different diseases. And this is the thing I think health should be holistic. So if you're trying to treat one thing, I spend most of my time reversing diabetes and blood pressure, but at the same time, it shouldn't affect, or it shouldn't negatively affect any other disease, like the autoimmune diseases. One of the best things you can do, we've known this for decades, if you want to reduce your risk of autoimmune disease, get rid of dairy products. And anybody knows that. I mean, you can even, and maybe we can discuss it later, you can even reverse some type 1 diabetes by getting rid of dairy products and some other things. Diabetes, I mean, half of my work is reversing type 2 diabetes. There's study after study that shows that the more animal protein in your diet, the greater your risk of type 2 diabetes. Now, what have I got here? Yeah, as I say, health should be holistic. Everything we do should impact positively every other aspect of our life. So if there are many ways to lose weight, there are many ways to reverse type 2 diabetes, but if that system impacts negatively on your heart, impacts negatively on other things in your life, then it can't quite be right. It's a bit like the drugs that we take. Some of the drugs we take for blood pressure cause diabetes. That's not something I'm ever going to recommend to people. Now, what have I got here? Okay, what about this then? I'm sure most of you have heard of the blue zones. Well, the blue zones are places where there's an unusually high proportion of people who get to the age of 100. They're very healthy into their old age. And they're not all exclusively plant-based, but one that I'm very familiar with is Loma Linda. I spend a lot of time lecturing there in the far reaches of California, and they are exclusively plant-based. And you go there. I was there just before the pandemic, and I was walking around with a woman who was 104 years old and trying to keep up with her. I mean, these people are incredibly fit, totally plant-based. So, I mean, if plants aren't good for you, then what is it that these people are doing so wrong? Okay, let me go back for a second. So this lady, just to summarize, this lady is someone who kind of encapsulates a lot of the things that I'm talking about. This lady had 4 different diseases and came to me, and just let her speak for herself.
Hi, my name is Sandra Holford. I used to be diabetic. I had an underactive thyroid and high blood pressure. I was also slightly on the heavier side. I'm now free of all medication. My blood pressure, my thyroid function, and my sugar levels are all normal. Thank you, Dr. Chidi.
Well, that really says it all. One of the reasons why I love doing what I do is because you can actually reverse disease. And my approach has always been a heavily plant-based diet. I will hand back to our esteemed moderator.
Thank you very much, Dr. Chidi, and thank you for sticking to time.
You're welcome.
Patrick Holford, you're up. So Patrick did hear it was 15 minutes, and so he has a few slides. If he seems like he's racing through them, that's why.
Okay, so nature knows best. Trust evolution. You probably know that 6.5 million years ago, we split from bonobos, gorillas, and chimpanzees. Their brain size stays the same, ours increases. And about 10,000 years ago, it hits about 1.5 kilos. It is now 1.35 kilos. In the last 10,000 years, we've switched from effectively living by the water and eating a much more marine-based diet to an animal and plant agriculture. So just bear that thing in mind. So I won't go through each of these points. Come on, clicker. Click, 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 click. Is there a better behind me? Oh, yeah. So there is a very, very good case that we became human because we started wading in water, and we were the apes who actually lived, were the waterside apes. And I explained yesterday that we're born with the vernix, as are sea mammals, but no land-based mammals. And that diet would have given us omega-3, selenium, iodine, B12, all these essential nutrients to really increase brain size. But it's not just about that, because fire comes along about 1.8 million years ago, and about 500,000 years ago, our ancestors are using fire, and with that, they could start to cook carbohydrate foods like beans that they couldn't do before. And we know from the genetic evidence that we start to develop amylase digesting enzymes. So our body adapts we can now have a larger food supply, and brain size actually increases in this phase where we have a little bit more carbohydrate. As shown earlier, the link between prostate cancer, in this case, and milk consumption is incredibly strong. And down there in the bottom left-hand corner, where you have your Vietnam and China and various other countries that really have no dairy products and a very plant-based diet, you have such a low rate of prostate cancer. And we really know why, and it's to do with insulin-like growth factor, which is a fundamental hormone. And you want it because it makes you tall. And Americans are tall and Chinese are small, at least the traditional rural Chinese. So we love IGF. It's there to make things grow. But the problem is if you have too much, you get cancer. And what happens is if you're consuming a pint or more of milk a day, and it could be organic or cheese or yogurt or sheep or whatever, because nothing wrong with milk, it just promotes IGF production, you will have higher IGF. And if you already have some cancer cells, particularly prostate and breast, they will grow faster. And if you look at the rate of osteoporosis or fractures, and you look at the rate of milk consumption in the world, it looks like they're the same. But the point is, I'm 65, I'm still breastfeeding from another species of animal. Do you think I'm weird? I'm talking about consuming milk. Name me a land-based mammal that has milk as an adult. There are none. So from a nutritional point of view, there is no requirement for adults for dairy products. So that's just a situation. Now, hemoglobin and chlorophyll are almost identical. Plants carry oxygen using chlorophyll, and in the middle of that molecule is magnesium. Hemoglobin, same thing essentially, and in the middle is iron. So magnesium is such an important nutrient that we've evolved to need. It's very, very important for the heart in many respects. And what Dr. Chidi is talking about, some of that benefit is going to be to do with this increased intake of magnesium, which is incredibly rich in greens and seeds. You get a little bit in meat, but really not much. It's mainly from plants that we get this magnesium, which is fantastic also for diabetes. In 2017, JAMA comes out with a big study which says nearly half of all deaths from heart disease, stroke, and type 2 diabetes are to do with suboptimal nutrition. Now, we did a survey, a rolling survey on 100,000 people, and we found exactly the same findings that they find. And that is the people who score the highest health and the least diseases are eating more fruit, more vegetables, more nuts and seeds, and so on. Meat, by the way, is shown in the orange there, is really kind of in the middle. It's neither sort of good or bad. But there is this point that the nut and seed eaters, particularly, you can really predict good health. Now, Paul Clayton, he does an analysis of a mid-Victorian worker's diet and comes to the conclusion that if we wanted to achieve the same kind of nutrient intake of a mid-Victorian worker today, we would have to be supplementing. The primary reason why we need to supplement is simply because we don't eat enough. And the reason we don't eat enough is because we don't need to. We don't need to hunt and gather and chop wood and fetch water. Our brains still have the same requirement. The roots and the mycorrhizae in the soil are really like our gut. It's the same kind of mechanism. So I won't talk about fiber and the microbiome. I thought that was going to be covered, but it's terribly important. And what we've kind of learned in a lot of the talks here is that human body can derive energy from ketones, from fat. It can derive energy from carbohydrates, a little bit from protein, a little bit from fermented food. And it's intelligent. It will always look for a source of fuel. And what's so fascinating is we are hybrid. We can run on glucose. We can run on ketones. I personally think there's an advantage in switching between the two every now and again to give yourself metabolic flexibility. Here's a brief film. So basically, all life runs on oxygen. We're all dependent on oxygen. And when you make energy from oxygen, what happens is you get oxidants. And oxidants, that's the oxidizing radicals, will ultimately kill you. So we have vitamin C, abundant in plant foods, which protects you from water-based oxidants. And we have vitamin E, abundant in nuts and seeds and so on, which protects you from fat-based oxidants, like chips, for example. And vitamin C is able to reload vitamin E, and vitamin E is able to reload vitamin C. And glutathione, which is abundant in onions and eggs and garlic, reloads vitamin C and E. And anthocyanidins, abundant in berries, for example, reloads glutathione. And then we have coenzyme Q, both in plant and animal products, and lipoic acid, which reload them. So these are the antioxidants that really support that anti-inflammation oxidative stress situation. So there are a dozen reasons to up vitamin C. You get a little bit in meat, but really where you're going to get your vitamin C is from plants. That's the primary source. And if you look closely at the liver and how it detoxifies, again, you see all these nutrients like glutathione, vitamin E, vitamin C, primary antioxidants. They're so important. And come on, click. I think the battery's going a bit low. So, for example, onions, so rich in glutathione, are phenomenally rich in quercetin, which is an incredible anti-inflammatory, and it's one of 3,000 polyphenols. So it's not just about vitamins and minerals. There are all these other compounds that are really so helpful to us. So we naturally gravitate towards different colors. We literally like different colored foods, and those different colored foods are giving us a nice wide array of antioxidants and polyphenols. So it's no surprise that when you look at surveys, what you find is 7+ servings of fruit and veg a day very, very consistently shows substantially less mortality. And why this is, click. I think it needs new batteries. Click. Yeah, here we go. It could be fiber, it could be lower GL, it could be polyphenols. And then we have lovely foods like olives, which are an incredible polyphenol, a very good painkiller, superb antioxidant. And then we learn about sirtuin genes, sirtuin activating foods. So there's an awful lot of stuff going on in food beyond just vitamins, minerals, and glycemic load. And that's how we have literally evolved. Now, cancer cells have something unique. It's called CYP1B1. It's an enzyme that does not occur in a non-cancer cell. And it turns out that salvestrols, a group of compound in plants, when acted on by the CYP1B1 enzyme, cause the cell to go into a state of apoptosis. And once again, all these wonderful salvestrol-rich foods, they are in plants too. So yesterday when I was talking about Alzheimer's, we spoke about omega-3 and we spoke about B vitamins. Of course, I would have loved to have spoken about insulin resistance and glycemic load. But on the right-hand side, that's where you have the vegetables and fruit, the antioxidants, the polyphenols, which are also reducing risk of dementia. And to give you an example here, folate, which is foliage, it's the B vitamin that comes from greens. Here's a study giving folic acid versus placebo, a very good study by Jane Durga. And what happened there on memory tests, the supplement users just given folate versus placebo had memory scores compatible to those of somebody 5.5 years later. So really we've gone from Homo aquaticus to Homo sapiens and now to Homo fatians and also to Homo caffeans. And I think we're going to be turning very soon into Homo appians. So we are devolving. And the fundamental message of this talk is, what did your food eat? It starts in the soil. Mother Nature knows best. Bow down, she's royal.
Thank you, Patrick. And that was 10 minutes. I'm impressed. A slide set that could do a 3-day workshop or a 10-minute presentation is impressive. Right, Shawn, over to you.
Okay, forgive me, guys. I've been in the same clothes for 3 days, still waiting on my luggage. So I'm going to have a little bit of audience participation here. Just if you'll do me a favor, just raise your hand up if you're a human being. So that should include most of you, I would assume, right? So and leave them up if you're there. Okay, so I want to see how many of you in the last, say, 10 years have increased your consumption of meat in the last 10 years. So that's just about everybody in the room. How many at that same? Keep leaving them up, guys. Having done that, have you seen, leave your hand up if you've seen an improvement in your health since doing that? And pretty much everyone, with rare exception, has seen that their health has improved by including more meat in their diet. Now leave them up still, I'm not going to tire you guys out. How many of you guys also leave them up if you cut back on processed food? And most of you. And then what about how many of you guys decrease the amount of vegetables you ate in your diet? And again, pretty much everyone's still leaving their hand up. So we're seeing that eating more meat and decreasing vegetables has helped you with your health. So that's a fact and not an opinion, right? So let's get started with this here. there was a kind of an outline. I was supposed to do 3 slides, so I kind of crammed a lot in there. And in the question, there's an evolutionary perspective. What are we or what were we? Well, according to this really nice paper by Mickey Bendor, Raina Barca, and Rafi Sertoli came out last year, they looked at what human beings or pre-human beings even were, or not human beings, Homo sapiens and the pre-Homo sapiens, Homo erectus and whatnot, what they were. And they looked at something like 25 different lines of evidence. And it pointed to the fact that we were extremely carnivorous, to the point where sometimes we were exclusively carnivorous. They looked at human physiology, genetics, archaeology, paleontology, zoology, and again, very, very carnivorous past. We sort of branched away from that around 85,000 years ago, and then we started basically out of necessity as our food supply started to dwindle away, all the megafauna started to dwindle, we became more and more plant-based. And so when we look at the beginning of science, when did science start? A lot of people would argue around 5,000 years ago in Mesopotamia, 3000 BC. Some of the scientific developers, Aristotle, Galileo, and then one of your guys, Sir Francis Bacon, came up with the scientific method. And supposedly, we're supposed to use direct observation, make a hypothesis, test the hypothesis, and then go back and make the appropriate adjustments. And so what I would argue is when we first started looking at science, humans had already ran out of food and became, more based on agriculture, because the earliest observations of science says, well, everybody's eating plants, so therefore we must be omnivores and we need to eat plants. If we were to start today and look at that animal there as a cat, right? It's a fat cat. Why is a cat fat? Because it's eating kibble and it's, grain-based. Cats, we know, are carnivores, right? We assume they're carnivores, but they eat an omnivorous diet, or many of them do, and they can eat an omnivorous diet. Cats can consume up to 60% of their diet in carbohydrates. Does that mean they're supposed to eat that? Probably not. And so I think we see a lot of similarities to that cat and a lot of the people we see in the population. They're obese, they're overweight, they're consuming the wrong food, yet they're able to. So does that mean a cat is an omnivore or should be plant-based? Probably not. Now they have an absolute requirement for taurine. We have an absolute requirement of vitamin B12, which we can't get outside of animal products. All right, next slide. Okay, so then the next topic we were supposed to talk about was saturated fat. Just a couple of studies here. This one came out in 2022 just came out there. Saturated fat, villain or boogeyman in the development of, or bogeyman, is that how you guys say it here, in the development of cardiovascular disease. And basically their finding was there's no evidence to show that saturated fat is causal for any type of cardiovascular disease. And I think this is a problem with nutrition science in general. When we rely on these large population studies, there are so many confounders that you can't actually draw an adequate conclusion. And usually the relative risks are so small, 10%, 15%, something like that. With the amount of confounders that are available, with the inaccuracy of even sampling the data. You ask somebody to take a food frequency questionnaire over 20 years and tell them, what did you eat for the last 5 years? How many errors do you think are going to be in that? So the risk of that is enormous. So another article came out in the Journal of the American College of Cardiology talking about saturated fat is not, once again, not causative. And I don't know if you can read that, but it basically says that saturated fat as it comes from whole foods such as meat, milk, eggs, things like chocolate even, are not causal for any type of cardiovascular disease. And then, let's see. Oh yeah, oops, sorry. There we go. And this is another one. This is a trend in the United States. Again, I don't have the UK data, but the United States and the UK are going to have very similar numbers. Since the 1800s, the amount of animal saturated fat that we have eaten has dramatically decreased, but we've seen a tremendous increase in chronic disease. And what has gone up significantly was the increase from 5 to 60% of the food going from non-processed to ultra-processed food. So I think, as Dr. Chidi pointed out, when you get people off these processed foods, their health gets better. And I don't think it's because you're eliminating the animal fat, because there's a difference between a healthy plant-based diet and an unhealthy plant-based diet. And what is the commonality? It's just all the processed food. So I think by eliminating the processed food, not necessarily the animal products, is where your benefits are coming from. And I think I'll leave it. No, I've got one more slide. And we wanted to talk about fiber. So, there are a lot of population-based studies that show that consuming fiber is associated with improvements in mortality. This is typical of, really, there are hundreds and hundreds of studies like this. And so the question is, what is the fiber replacing, right? Is it replacing a steak, Or more commonly, this picture shows it greatly. This woman's looking at an apple versus a cupcake. And I think that's where most of the benefit is. You're using fiber to replace low fiber foods, which again, these ultra processed foods. And so I think that's where all the benefit's coming from. So if you're going to eat a mixed diet, then heck yeah, eat some fiber. But does that mean it's essential? If it was essential, I would long be dead, right? I mean, clearly I have scurvy and clearly I'm dying from lack of fiber, which I haven't really had in any in 7 years. And so to say that it's essential is hard to say. And then to use this population data to predict the future, which I think we do a very poor job with. Any kind of scientific modeling almost all the time is wrong. And so this is what we're doing. We're modeling the future based on very poor evidence and trying to make decisions on that. I think we can. So I think my focus is to take someone in front of me who is sick and make them healthy today. And I think that's all we can realistically do. And if we try to talk about where you're going to live to 100 or 110, I think you're really, really misguided if you think you can predict the future in that way. So that's it for now.
Excellent, Shawn. Thank you very much, Shawn. That's brilliant. Right, next we're going to go to Dr. Anthony Chaffee. Thank you very much. Go for it, Anthony.
All right, thank you. So I'm just going to share my screen. Sorry, I was having a bit of technical difficulties in setup, so I won't be able to go through slide share, but I can just put it here for you all, and we'll just sort of go through them one by one, but it won't be in the share format. Okay, so I would argue the same as Dr. Baker, that plants are not necessary in the diet. We see this in multiple different examples in humanity, currently and historically. I would argue, as Dr. Baker has, that plants are not an essential part of the human diet. There are multiple examples in history and current civilizations today where people eat very little plants in their diet, or possibly even no plants. If you look at the Inuit living towards the North Pole, there really aren't even any selection of plants to eat, and yet they live generation after generation after generation. You cannot live intergenerationally if you're missing essential nutrients. Even if you're missing something slightly, after a couple of generations, it will catch up to you. So we know that they are not essential. You don't have to have them. Now, do they provide benefit? And that's a very good question. Just try to move my slide along here. Sorry. So there's sort of a lot going on here. I don't have the buildup that I normally do, but quite recently we had the 1977 USDA declaration saying that cholesterol causes heart disease, saturated fat increased cholesterol. Stop eating both of them for your heart health. And this sent a wave of guidelines and recommendations that we are still seeing today. And since then, what do we replace this with? What do you replace the fat and the meat that we're eating? Well, obviously, you're going to replace those with plants. We increase the amount of plants we're eating, fruits and vegetables, but also carbohydrates. And certainly significantly, we increase high fructose corn syrup and seed oil by over a factor of 3 since the 1970s. And we reduced red meat by over 33% and reduced fat and cholesterol by roughly the same margin. And since then, people have gotten sicker. In fact, heart disease prevalence has increased. Our death rate from heart disease has gone down, but we also are smoking a lot less. And we also have a lot of interventions, such as Dr. Chidi explaining that we can do bypasses and intervene preemptively with stress tests and put in stents and so on. So we have better treatments, but that doesn't mean that the rates of heart disease are going down. In fact, they're going up. So the original studies looking at cholesterol and vilifying cholesterol have actually been shown to have been fraudulent, not just wrong, but fraudulent. So the Journal of the American Medical Association published in 2016 actual internal memos from the sugar companies back in the 60s detailing how they paid off 3 Harvard professors to falsify data and publish fraudulent studies to make it appear as if cholesterol caused heart disease when it was more likely sugar. And there was research to show that sugar was strongly correlated with the rise in heart disease, as were seed oils. And one of those professors was named head of the USDA, and it was he who authored and published the 1977 USDA declaration saying that this was bad news and to give it up. So this is not an opinion. That is a fact. That's in the historical record. That's in the peer-reviewed literature. We even have their contracts. We know what they were paid. They were paid $6,500, which is about $50,000 in today's valuation. So not all that much. And then the Framingham study, which I'm sure most of us studied in medical school and were taught in medical school. This was a long study over the course of a few decades, looking at different factors that are associated with disease. And one of those was with cholesterol and heart disease. And I was taught in medical school that this showed that people that had higher levels of cholesterol actually had higher levels of heart disease, as you would expect if this was your theory. The problem is that that was actually a misrepresentation of the Framingham study. The American Heart Association actually misreported that finding in the Framingham study 2 years after it was published. They actually found the opposite. People that had lower levels of cholesterol actually had higher rates of cardiovascular disease and death. So that, again, is another instance of fraud. And then you have the Seven Nations study, which is Ansel Keys. Ansel Keys was a very famous doctor who came up with the cholesterol hypothesis for heart disease. And he was also a known paid shill of the sugar industry. And we know that we have his contracts, we have these documentations as well. So this, again, is not opinion. This is a matter of historical record. So there's never been any high level evidence to show cause and effect relationship between higher levels of cholesterol or saturated fat and heart disease. And in fact, there are multiple studies showing no association between the two. Now, you can't prove causation from correlation, but if you show that there's no correlation, that proves there is no causation. You obviously have to have at least a correlation if there is a cause and effect relationship. So there are a number of studies that show that when you lower LDL cholesterol, it's going to actually increase all-cause mortality, increase cancer risk and cancer death. And then we sort of look at, well, what actually happens in the population with real people in real time. So there was a large study with 140,000 heart attacks in the U.S. With people with heart attacks, and they found that 50% had low or normal LDL cholesterol. And so this showed absolutely no correlation or relationship between the level of LDL and those who suffered from a myocardial infarction. And in fact, they found that those who then lowered their LDL cholesterol had 2 times the risk of death in 3 years of follow-up. And that was statistically significant. So this is something that when you look in practice, what are our interventions doing? We're finding that they're either not having any real effect, or they might actually be causing harm. That's something to take very seriously. So as Dr. Baker mentioned, there was the study from the Journal of the American Medical Association in 2020 that did a large literature review, looked at all the meta-analyses and all the best evidence, and they found that there was no association between saturated fat intake and heart disease. But in fact, they found an inverse relationship between saturated fat intake and stroke risk. So people who were eating more saturated fat had a lower risk of stroke, and those who were eating less saturated fat had, in fact, a higher risk of stroke. So again, with real people and real outcomes, that's something to take serious note of. So from an evolutionary standpoint, I think this is an excellent part of this, because I think this is what it all boils down to. What are we as animals? We are animals. We did not come here from space. We did not just drop in here out of nowhere. So the same physical laws that apply to other animals and other forms of life apply to us as well. And all animals have an extraordinarily specific diet in the wild. And zookeepers will tell you this: if they eat outside, if you feed an animal something it doesn't eat in the wild, something it didn't evolve on, it gets very, very sick. And this is why you have signs at the zoo that say, don't feed the animals. It will make them very sick. Don't feed the animals the thing that you are eating right now. That should tell you something as well. But what do they get sick with? They say they get human diseases. If you feed animals human foods, they get human diseases. Well, these are non-communicable chronic illnesses. They are not catching diabetes or cancer or autoimmune issues from us. They are catching this from the food that they're eating. They're eating something they are not biologically predisposed to digest and absorb and detoxify, and they are getting toxicities from that. And I would argue that we are too. I think we would all argue that. It's just the fine points of which things are causing what problems. So if you look at a stable isotope study, this is something that was used in Dr. Mickey Bandor's research and other research. This looked at the amount of stable nitrogen-15 that's in the fossil record, and you can see exactly how much concentrates in. This is how high up or down the food chain that you are, and found that humans had a higher carnivore rating that humans and Neanderthals, Homo sapiens and Neanderthals, had a higher carnivore rating than other carnivores alive at the same time, like lions, hyenas, foxes, and wolves. And so this actually shows that we were eating quite a lot of meat. And in fact, we're apex predators, top of the food chain. Apex predators don't graze, by and large, right? So they eat animals around them, and they don't have the capacity to break down and detoxify the plants, because that is a plant's natural defense. So herbivores are specially designed to break down fiber and other sorts of plant materials in order to absorb the nutrients and detoxify these harmful agents which the plants use to defend themselves. This is just a natural ability of the plant to defend itself. It's always important when we talk about these sorts of things, we always have to say compared to what? So compared to a processed food diet high in seed oils and processed sugars and refined carbs and things like that. Yes, going to plant-based, going to nearly any other sort of whole food approach is probably going to be quite significantly better. And when you look at some of these issues with confounding factors and also with these studies that vilify meat, quite a lot of them are painting meat with the same brush as processed foods. So in some studies, from Loma Linda, from the Seventh-day Adventist population there, they would actually consider pizza meat because sometimes the toppings are meat. So pizza as a whole is meat. Fast food contains meat as ingredient, therefore fast food is meat. So people are eating less fast food, less pizza. They were having better health outcomes. And I wonder why, but they were saying it was because of meat, but that's not actually the case. So there's only one study that I know of that anybody's ever been able to show me that has a direct comparison between a whole food plant-based diet and a whole food meat-based diet. And that was published in the Journal of the American Medical Association way back in 1931. So we've known this for quite some time. And it compared the Maasai with the Akikuyu, who are two African tribes. They live right next to each other. And the significance of that is that they intermarried. So they were genetically similar populations, alive at the same time, in the same area, in the same conditions, and the same genetics. Akikuyu were largely plant-based, and Maasai are famously animal-based, actually quite a lot of dairy. They drink a lot of raw milk, drink blood, and eat meat. They found that there were significant differences in development as well as health of these two populations. The adult male Maasai were on average 5 inches taller than the Akikuyu, on average 23 pounds heavier of lean body mass, and over 50% stronger. And they didn't have any of the serious diseases and infection risks and malnutrition that the Akikuyu had. The Akikuyu had quite a significant amount of nutritional deficiencies, and the researchers found that if they supplemented them, this actually didn't cure their medical issues. That it wasn't until they reintroduced meat and started pulling down on the amount of plants that they were eating that they started to recover their health. It was discussed earlier that our brains have increased quite dramatically. You can see from that slide there, it did quite dramatically around 2 or so million years ago when we became primary hunters of large game. We'd be able to, instead of scavengers and scavenging off the remains of other predators, we were able to get these large mastodons, eat the organs and the livers and the fat and everything that we wanted to eat. Our brains grew dramatically. Then if you look at right at the very end there, right around 10,000 years ago, in the advent of the agricultural revolutions, a sharp tick down. And as mentioned earlier, our brains have shrunk by 11% since that time. I would argue that that's developmental. We are not giving ourselves the proper nutrients to grow our brain and body, and we are worse for that. In fact, we're shorter now on average. Back then, different populations that were hunting mammoths, they were on average anywhere from 5'10" to 6'2", sometimes even 6'4". Now in America, we're talking about how Americans are so tall. Well, in fact, we're only about on average 5'8" for the adult males. So this has gone down. And I think that is purely due to diet. And again, ice ages towards the North Pole, no plants were available at all anyway. So if they were necessary, if they were vital, then we would not be here. Those people would not have survived. So we have to look at what's biologically appropriate. What do we evolve on? What are we designed to eat? Right? So what we've been eating for the last several million years is more likely what we're evolved and adapted to eating. It's only more recently that we've been introduced to plants. So meat is the most bioavailable. You get absolutely almost everything from the protein to the nutrients to the fat is bioavailable. You don't have toxicities like you do with plants. We aren't eating the same plants that were even available 50,000 years ago. So how are we arguing that we evolved to eat this way if the plants that we're eating now didn't even exist when we were evolving? There's quite a lot of work from Weston A. Price, who showed a lot of people, and they were eating very meat-based diets in these rural areas or in primitive areas, were very healthy, proper teeth and jaw development. Vilhjalmur Stefansson, professor from Harvard, wrote the book called The Fat of the Land, lived with the Inuits for over 12 years and ate no plants and was extremely healthy. You notice that they were extremely healthy as well. And Harvard did a study on their teeth as well, perfectly developed teeth and jaws, just on a meat-based diet.
And Anthony, totally fascinating. I'm just going to pause you there, and appreciate you got some more slides to do. Unless you want 30 more seconds, or do you want to come back to these?
I can wrap it up very quick. Yeah.
Okay, go for it.
Yeah, sorry about that. Yeah, very sorry. So I think other people have touched on fiber, but there are a number of studies that have actually looked at the gut and actually seen, is there any sort of disease, looking at diverticulosis, and they found that with over 2,000 patients, the only things that showed an increased risk was increased amount of fiber and increased number of bowel motions. Okay, so that it wasn't meat, it wasn't constipation, it wasn't anything else. It was actually fiber was a risk factor for diverticulosis and age, of course. And then the Inuit, who again don't really eat meat, they've actually found that their microbiome is extraordinarily healthy and diverse as well. So plants contain a lot of toxins. That's the main marker, and this is something that Professor Bruce Ames and the WHO have written extensively on. That there are a number of these toxins that we have to contend with on a daily basis and either detoxify or avoid for proper health. And so, if you have to do that, then you're talking about something that you're not designed to eat. If we were designed to eat them, then we would be able to detoxify these things naturally, just like a cow would when eating its primary food. So to sum everything up, there are no essential nutrients that are absent from meat. You get everything you need from meat in the level that you need it. And there are many essential nutrients that are absent from plants, just such as B12. The RDAs are very different if you're eating plant or animals, and vitamin C, for instance, if you're not eating carbohydrates, you only need them measured in nanograms, whereas if you are eating carbohydrates, because they block out their absorption and utilization from the GLUT4 receptor, you need them in milligrams. You need 1 million times more vitamin C if you're eating carbohydrates. So plants absolutely can have positive aspects, but that doesn't mean that they don't come without a cost. And they can be more harmful than good, potentially, depending on the plant. Most plants are inedible and will actually just kill you. Outside of starvation or privation or medicine, of course, these things can be used medicinally, and they have for thousands of years. But even if they're not doing more harm than good, even if they're a net positive, are they as good as what we are optimally biologically designed to eat? I would argue no. And I would argue that a lot of the human diseases that we're treating nowadays are not diseases per se, but toxicities and malnutrition brought about by by not eating a species-specific diet. And some people will say, well, I ate a salad the other day and I didn't die, therefore it's not dangerous, it's not deadly. Well, that same argument could be applied to cigarettes and alcohol, right? You smoke, you drink, you don't die that day, but it takes years and decades to break you down. And I would argue that some of the things that we're eating that we're not designed to eat in plants are doing just that. And I think for that reason that it's best to stick to a species-specific diet of just meat. Thank you very much. Sorry to go over.
Thank you very much, Anthony. That was fantastic. Okay, next we have Dr. Hayley Wood. I think I've heard briefly what you're going to talk about, and I think the importance of this and kind of linking to my work I do as a GP and seeing real human life, how important real human life is, and how nutrition plays such an essential role in that, and how this actually, for many people, it's the here and now that you see the difference happening. So over to you, Hayley.
I have a little cheat sheet. I didn't want to miss things because this has become kind of such a well-run story for me in my head, but there's actually really significant bits that I don't want to miss out when I'm covering here. So I want to talk about a patient that I had back in 2009. So we're going to call her M, and I met M when I was working in paediatrics in South Africa. And she came to us at 14 months old, weighing just 3.8 kilograms. And she was diagnosed with Kwashiorkor syndrome. And this is really important because Kwashiorkor is a protein malnutrition, and it's characterized really by kind of a lot of fluid retention. So we see distended abdomens and we see fluid collection in the peripheries, because without enough protein, the body can't hold on to the fluid. We don't have enough of that sort of oncotic pressure that keeps the fluid in. It also leads to hair loss, skin conditions, enlarged liver, huge amounts of gastrointestinal symptoms, loss of muscle mass, massive immune system problems. It's basically a kind of thinning of the GI tract and like loss of cells around the GI tract. growth and developmental delays, and just generally very poor development across the whole body. With the immune system problems, we find that we don't get very clear immune responses given when the body encounters bacteria. So particularly in Africa, you get all sorts of bacteria and parasites and things that will inhabit the body, and there isn't much of an immune system response mounted against those. So we rehydrated M and we put her on nasogastric feeding. It's actually quite cautious to refeed somebody with kwashiorkor because, the body's not used to receiving that food load. It doesn't always know what to do with it. So a lot of the GI symptoms continued. It didn't go terribly well for the first few weeks. And the immune system decided to respond very heavily. So and we started on a number of medications that kind of assisted this response, really. It's good in the long run, but in the short term, it can be quite catastrophic. So we got conditions like TB of the chest and abdomen, we got pneumonia, we got, I have to check my list because again, I'm so used to doing this. TB, pneumonia, M entered status epilepticus, which is, it's a prolonged seizure. So she was on medication for over a week to try and control basically a week-long seizure. There were numerous amounts of antibiotics involved in her care, IV antibiotics as well. We'd finish one load of antibiotics, another problem would start, we'd bring in more antibiotics. Eventually, over the course of about 2.5 months, she'd stabilized enough to leave the hospital. And about 6 weeks later, she was back with us. Very similar problems, not the kwashiorkor, but ongoing GI problems. A lot of infections, so skin infections had become a problem as well. Again, very poor food intake, very poor fluid intake. And she was with us probably for about another 6 or 8 weeks, and then went off to a children's home, which is very common in South Africa. Very long story short, in 2011, M became my adopted daughter. Sorry, it's really weird to say. It's just so strange reading all this and knowing the person that I know now. Sorry, this isn't related to this talk at all. Moving on. So I was faced then with a very difficult decision because I'm plant-based. I've been vegetarian since I was 12, 13. So I haven't eaten any animal. I ate very little even before that. My mum tells a story how I would chew my food, my meat, and put it back down on my high chair and leave it there. So it's never been natural for me to eat animal products. I would have had very little dairy because I don't like it. I felt it would make me quite nauseous even as a young child. I grew up in Thatcher's Britain with milk in schools. Milk was not my friend. So I now had this difficult decision to make because it's not now a patient. And I think that this is what we as doctors and scientists maybe lose sight of, because in patients it's very easy to instruct and to read off a script and to quote research and to sort of encourage people and say, well, no, this is the right line that we're taking. The literature says this, my experience says this, as a detached person from an evidence base. When it becomes you and your direct responsibility for the rest of your life, it's a very difficult decision to make. Because I knew that I was going to find it incredibly difficult, if not impossible, to actually work with meat myself. But I had to get my head around having to do that for the sake of, a young person who is now my responsibility. So I started off with all of the dietary things that I knew worked for me. I did start to delve into literature at the time, but I was working about 100 hours a week, and this is all, parenting was not something that I'd anticipated on. It was incredibly new and different. I think Mwandi became my daughter with about 48 hours notice. I didn't get the 9 months plus, which is normal. So it was quite a quick adaptation process. And I did start to look at the literature, but actually I felt so overwhelmed given everything else that I felt a bit dizzy and sick from it, and I couldn't cope with it. And I went back to what I knew from my own experience and my own background before medicine, which is to do what feels right. What did I feel good on? What had worked for me? What had always made sense to me and served me over the years? So I bought in probiotics. I bought in fermented food. I bought in a lot of nuts and seeds, and reduced dairy. I eat a lot of tofu, organic, and I included that as well. And then I thought I'd sort of see what else happened around that. So whenever we were out and people gave her meat, I allowed that to happen. I didn't have any problem with that. What I found was that she was still incredibly ill when she came to live with me. There was still a lot of additional health needs. As they improved and she became a lot more stable in her diet, developmental milestones had been quite delayed, and suddenly they started to take off a little bit more. Everything really stabilized. The GI system, within the course of 4 weeks, was unimaginable. The gastrointestinal symptoms weren't governing our life anymore. It's very difficult when you have a young person with gastrointestinal symptoms to take them places, to go out and do things. All of that stopped. What I found then was when we were going out to people's houses, and it's South Africa, so we would have eaten out a lot in people's gardens, barbecues, things like that. She started to not touch meat. She didn't want it. It was left on the plate. So I left it there. We had the I suppose, great benefit of checking bloods very regularly. So I could measure things and monitor things. Being a doctor in the hospital, I would sneak extra things into the tests that were being done outside of clinic so I could keep a track on things like B12, vitamin D3, and supplement as was needed. But I really approached it from, I suppose, a very common sense point of view. And I didn't delve into the studies, and I didn't delve into the numbers and how things were changing. Particularly in the past 10, 15 years, nutritional science and what we know has evolved, and it's evolving at such a rapid rate. It's incredibly difficult to keep up with. Never mind for your own knowledge and awareness as a practitioner, but trying to then put that in place in a lifestyle that you live every day under pressure, is also, it's challenging. So coming at this as a parent, was I cut the crap, I cut all the noise out, and I just went really to what I knew and to what I trusted in myself and what I saw in the young person. And I just paid close and careful attention. I did monitor the numbers, I was aware of supplementation, and that's how we've evolved, myself and my daughter. We keep the same diet now. So she is now 15. She is doing unbelievably well. The bloods are absolutely fantastic. There's some holes in the macula in the back of the eye caused by TB. So she's partially sighted, and there's a few extra learning needs, but it's all very mild. She's like a little athlete. She's like a little piece of rubber. She does gymnastics, she does running, she does dance, everything like that. There's certainly no fear of her, as we say in Ireland, in terms of the physical performance and strength and muscle formation and anything like that. Energy levels through the roof. She has had gastrointestinal symptoms twice since she came to live with me. Now, when I look at other kids through the years who she's been in school with and other patients that I've worked with at that age, her symptoms and frequency of symptoms are negligible by comparison. Same thing, coughs, colds, flus, they're done in 48, 72 hours. She's healthier than I am. So we're primarily plant-based. Em would eat a little bit of cheese now and again, and she eats eggs now and again. That's pretty much it. So, yeah, that's my personal experience as a practitioner of plant-based living. And a good example, I think, of what it can do, perhaps if the circumstances are right.
Thank you very much, Hayley. Thank you very much. We will have a 1 minute break. So you cannot be at a metabolic health conference and sit for 2 hours non-stop. So we'll have a 1 minute break, just stand up to stretch our legs. And then we'll go on to kind of really explore some of these topics in depth. And what I suspect is there's probably emotion riling up in people, not only with what really happens in real people's lives, but also hearing some of the studies that you may or may not disagree with or agree with. And we need to dive into these and gather some perspectives. What a privilege to get such a wide range of thoughts, ideas, facts, research. I think what I'm sitting here thinking is I'm trying to categorize what I've heard in my brain to create some coherent discussion. And I think I'm categorizing it into there's food we eat matters. There is a short-term impact of that, and health can have a short-term, or what we call acute impact on our health, either make our health worse in the moment or make our health better in the moment, and quite radically sometimes. And then there's a longer-term piece. And I think some of the things we heard around perhaps epidemiological data and an possible increased risk of something happening over a number of decades, which I think influences perhaps many of the food and dietary decisions people take, but they're making decisions and not seeing any immediate feedback on them for them as an individual. So I think we need to explore some of that, because probably in my clinical practice, these things scare people, I guess. If they hear something might cause something in the future, it might scare them, which might affect the decisions they make. So I think we need to openly discuss some of these areas and tease them out. How about we start with, should we start with fiber? And the reason I say start with fiber is because I know I have patients that will eat a lot of fiber and feel great. And I know there are people that massively advocate fiber. I also have patients that eat fiber and within 20 minutes, their stomach's blown up and they're uncomfortable and becoming constipated. So where should we start? Dr. Chidi, would you like to share some thoughts from your perspective on the role that fiber plays?
Well, I obviously think fiber is absolutely essential for our health, but perhaps I can do, I mean, for much of what Dr. Anthony was saying, I was agreeing and nodding because, yes, a lot of the research, and sometimes when we flash these research papers about, we need to know who is actually the authors of this research, what is their agenda? And I think that is very important for all of us to understand. But something that he mentioned about diverticulosis or diverticular disease, which is where you get these pockets in the large intestine which can become infected, that's absolutely true. And it does seem quite counterfactual to me that, yes, most doctors will say if you've got diverticulitis or diverticulosis, the thing you need to avoid is fiber, because it will aggravate it. Absolutely it does. But that's not dealing with the root cause. So fiber can aggravate it in the same way that fiber can aggravate Crohn's disease, inflammatory bowel disease. Those are not the causes of the problem. Those are just things that will now aggravate. If you want to know what causes a lot of diverticulosis, these pockets, it's because the bowel is trying to squeeze very hard this hard stool that hasn't got a lot of fiber and water in it for decades of your life. And that leads to the actual problem of diverticulosis. So yes, we can talk about the symptoms, but let's deal also with the causes. If you want to have a colon free of diverticulosis, well, you're going to need a lot of water and a lot of fiber in the diet to help that stool pass easily throughout life. These diseases are built up throughout decades. I mean, people come to me, oh, I've got diabetes, and they expect a quick fix. It's taken decades to get here, and sometimes it takes a little bit more than a few months to reverse it. But that was, I mean, if I really wanted to crystallize what I feel about fiber, that point really does it for me.
That's fantastic, Dr. Chidi. Thank you. Anthony, I think it'd be useful if you could respond to that. And there's a couple of key areas I guess I heard in there around the fiber and hard stool if you don't have fiber, and yeah, explore your thoughts on that.
Yeah, no, absolutely, and you can absolutely have things that are exacerbating a problem that already exists. Interestingly, in that study that I mentioned that had over 2,000 colonoscopies looking for diverticular disease, it actually didn't find that constipation was a risk factor in that study. I'm sure there are others that would find that. The only factors that they found as a risk factor were increased amount of fiber, in fact, and then increased number of bowel motions a week, particularly, and namely over 15 bowel motions a week. So on average, more than 2 a day. So that wasn't for diverticulitis. That was just for the development of diverticulosis. And so I thought that was quite interesting. There's a couple of other studies. I mean, there are a lot of studies on fiber, obviously, but there aren't any randomized controlled trials, interventional trials that I'm aware of. There are some smaller interventional trials, and one of them I think had around 60 patients. I sort of had it up on my slides, but didn't get a chance to get to it. And these are all people that suffered with symptoms of IBS, and they found that, so they're already symptomatic, and they found that they stratified them out in different intakes of fiber, some increasing the amount of fiber, some staying the same, some reducing, and some eliminating. They found that actually when you increase the amount of fiber, their symptoms of IBS actually increased. When they reduced the amount of fiber, it decreased. And the people that eliminated fiber actually had resolution of their symptoms. This is a small study. It's not necessarily powered to the extent that any of us would like, but it is one of the few interventional studies with fiber. There was another looking at the symptoms of constipation, and they found that actually that people that had less fiber, or even no fiber, actually had more regular bowel motions, or more more frequent bowel motions, I should say. And this was sort of not in keeping with what we would normally think of it. The more fiber that you eat, you probably would increase the motility and peristalsis, and you would move out. But in this study, and again, these studies aren't perfect, they found that people that didn't eat fiber had on average 1 bowel motion a day, whereas people who continued eating fiber or more fiber had a bowel motion every 1.6 days. So it was, interesting in that regard as well. As far as, do we need it? Well, there are 66% of animal species are carnivorous, and they don't eat fiber on a regular basis. They're able to have regular bowel motions and bowel health. We cannot break down fiber. Generally, if you see an animal eating fiber in the wild, it has the ability to break down that fiber into short chain fatty acids, and it actually gets the majority of their nutrition from that. We don't have that ability. We've lost that ability quite a long time ago. We have an appendix, which is a vestigial cecum in gorillas or chimpanzees. That's much elongated, and that's where a lot of fiber will pack in and break down into short chain fatty acids. And it appears as if we've lost that ability, possibly because we've stopped eating fiber quite some time ago, and now we've reintroduced this now, but we don't have the same physiological ability to break down the fiber. So is it required as an essential nutrient, as it is actually classified as an essential nutrient in America? I don't know. I don't know if we could actually really classify it as a nutrient, because we don't actually gain nutrients from it. And we could say, does this help our constipation or bowel disease or anything like that? Or does it break down slightly into butyric acid, and does that help the enterocytes? Sure, and that is a nice fuel for them. But if you're on a ketogenic diet, butyrate, butyric acid, these are major components of the ketone bodies that we make all the time, and those will absolutely fuel our enterocytes as well. So I don't think that we have to have it. There are certainly examples in current civilizations, like the Inuit, like the Maasai, really don't eat any fiber. Myself and Dr. Baker, I don't think we've had any fiber in a number of years. Myself, about 5.5 years. Dr. Baker, longer than that, and other people quite a lot longer than that as well. And our bowel habits, I won't bore you with those, but they're perfectly fine. So I don't think that we have to have them. And there's mixed information in the studies, but from what I've seen, some of these better studies are actually showing that it's not necessary, and sometimes could potentially cause harm.
Thank you, Anthony. Thank you for sharing that. Shawn, I think it'd be useful to come to you next. And following on from that conversation, let's say somebody wants to start a carnivore diet and they're concerned about what might happen to their bowels. because this is the real life stuff, isn't it? They've heard this may or may not be. Your thoughts on that, and probably a diversity of people, perhaps, that you make a diversity of different responses. So microphone that you can grab.
Yeah, I'll just echo Anthony's statement. Fiber is not essential. If it was essential, I would have long died. So it's clearly not essential. Now, is it conditionally beneficial? Sure. As I mentioned, if it's replacing processed, highly processed junk food, you're going to do better off eating fiber. But as far as switching over to a diet that contains no fiber, your bowel habits are going to change. Of course, you're going to waste much. You're going to waste much less, right? So, I mean, when we look at what is in stool, it's fiber, it's bacteria, and it's basically sloughed off enterocytes and a little bit of the digestive juices. And so your bowel frequency, your bowel volume will go down significantly. I don't think that's a bad thing. I mean, the less time you spend on the toilet, the more time you have for other daily activities. So that's probably beneficial. But yeah, you'll definitely see a difference in what your output is, and that's expected. If your diet basically results in you half your nutrition going into the toilet, it's a very inefficient diet. That's why we look at things like gorillas who consume. They're not much bigger than I am. I'm almost the size of a silverback gorilla. I mean, it's kind of funny. And I eat maybe 4 pounds of food a day, whereas a gorilla has to eat 40 to 60 pounds. And they go to the bath. They produce an 8-pound baby of feces every day. And that's a very inefficient digestive system. And I think if you look across all species that have ever existed on planet Earth, something like 85% of them have been carnivorous because it is more efficient. It's a more efficient way to get the nutrition. If I'm building a house, if I want to build a brick house, I would much prefer I already had bricks rather than having to make it from bricks and straws. And so when you have a fully plant-based diet, it's just less efficient for you to get the nutritional requirements that you need. Animal cells are most efficiently built by other animal cells. And I think that, again, the fiber issue is clearly if you're on an omnivorous diet, then yes, eat lots of fiber. Hopefully your digestion will be okay. There's been a recent study out there looking at rheumatoid arthritis, and it showed that higher fiber diets actually exacerbate rheumatoid arthritis symptoms. And it had to do with interaction with Prevotella species of bacteria. And so we're finding out that perhaps, and what I think is the modern diet is so awful, so horrible, it's destroying all of our guts. And some things that we could have potentially tolerated more easily in the past is now becoming more and more difficult. And the things we tend not to tolerate very well are even some of these whole foods and some of these plant-based foods. And whereas meat is extremely well tolerated, and I think dairy and meat are a different category because people always lump dairy and meat and processed foods together. And I think they're all three independent variables that have to be treated very independently.
Fantastic. Thank you, Shawn. Patrick, do you have...
Yeah, I think there's three confusions here. First of all, we have soluble fiber and insoluble fiber. And what actually happened was Burkett and Trowell were the guys who went around the world collecting stool samples, appropriately named, and found that people who had soft stools and more frequent bowel motions lived in countries that had very small hospitals. And people who had hard stools and less bowel movements had lots of hospitals. So that's where it happened. But what happened was the food industry jumped on the back of this. They wanted to make refined flour high in gluten, which means you have more glue. And when you feed yeast sugar, you get more bubbles. So you can sell a lighter loaf and make more money. And the byproduct was wheat bran. And that is an insoluble fiber, and it's no good for the guts. And that's what's going on. So if you look at the actual studies on fiber, it's very confused. But if you realize there are soluble fibers and insoluble fibers, it's a very, very different story. And the evidence for insoluble fibers, for soluble fibers, like in oats, for example, being good for you is extremely strong. But I think the real, so that's like point number one. You can't just say fiber because there's two very different kinds. Point number two is that the biggest issue we're dealing with is in many Western countries now, the single biggest killer of people under 50 and adults is colorectal cancer. And generally, the consistency there is that there are three problems with eating meat in the way that most people are eating meat. And number one is we cook it, and we burn it, and we fry it, and we grill it, and so on. And that creates PAHs, polyaromatic hydrocarbons, which are a known carcinogen, and HCAs, heterocyclic amines, which is a known carcinogen. And even hemoglobin can act as a carcinogen, the heme part of it. And then the issue becomes bowel transit time. So this may not apply if you're eating raw, wild meat. And I happen to spend a lot of time with the Maasai and the Kikuyu. I have a house on an island off Kenya. So I know about these. And some of the things that are being said about the Maasai are just quite frankly wrong. They don't have a diet throughout their life of meat and milk. They only do that little bit of blood and milk when it's the dry season. They've got to drive their cattle to a distant river. And they've run out of foods. And actually, the Maasai are having terrible problems right now with B vitamin deficiency, and they're learning to grow greens. But, that's another sort of, side story. So the issue in the Western world is we've got this epidemic of colorectal cancer. And if we are introducing carcinogens, because we don't eat raw meat and we're not eating wild animals, which, by the way, have virtually no fat. If you go into the place where we all came from, Africa, and you run around on safari, all these wild animals are incredibly lean. They're not fat. So it sort of makes me interested when we say we want grass-fed beef. Now, cows didn't live in a field, in prison, with a hedge. So they just had to eat that food, which of course is much better than the stuff that we're force-feeding cattle. These were forest animals. They were foraging. They were eating the hedges. They were eating the herbs. They were eating a much larger variety of food. So, we didn't evolve. I mean, it's clear that we didn't evolve eating the kind of meat that we're eating today. And I often wonder, we always say carnivore. Why don't we say fishivore? I mean, even the Inuit, they were eating seals phenomenally. I mean, you probably know what happened there was that the Inuit have a very low rate of heart disease, and we've learned that DHA is very rich for the brain. We know that the omega-3 came from the plankton in the ocean, which the little fish would eat, so they would start to concentrate EPA and DHA, and then the big fish with teeth like the mackerel and salmon would eat them, so they're really, really good, and then the seals would come along and eat them, so seal oil is by far the best source of DHA. And of course, so the Inuit, we can't really say, we say they are carnivores, but let's face it, they were eating seal meat, which has some very specific properties. So we have at least learned that if you want to have a healthy brain and a healthy heart, you eat Eskimos.
Thank you, Patrick. I think in the spirit of what this session is, we shouldn't necessarily move on to a new topic, but I think we need to ask for responses to some of these points. Would anybody like to respond to anything they've heard so far?
I would just like to say that in obviously my current work for a number of years has been psychiatry. So in terms of the mental health aspects of fibre, there are studies that show that increased fibre intake, going from a diet of ultra-processed foods, improves mental health symptoms, and we know that most serotonin is produced in the gut. So if you're increasing the fibre intake, improving the quality of the fibre that's going in, then hopefully it's feeding the bacteria that produce the serotonin. But yeah, it's certainly something I've seen in my patients as well. It's a really simple thing. It's a really simple dietary thing to change to improve the fibre content, going from ultra-processed foods to more whole foods. And there's improvement over time, over several months in depressive symptoms.
And you see that happening clinically with them?
Yeah, you see like this. I mean, that's always now, I think, given my experiences, is what do you see, not what's measurable, but what do you see in front of your eyes? What's the person's reported experience of that? And if you see that more and more times firsthand, that's your evidence right there. It's like what Shawn's saying about his lifestyle and how, the experience of it and seeing it in the people around you is the biggest impact, I think, the biggest proof. Yeah.
Brilliant. Thank you. Shawn?
Well, I was just going to say, because you mentioned, when you replace ultra-processed food with fiber, that's clearly going to help. Because I think, again, whether you're plant-based or meat-based, the ultra-processed food is the big problem here, clearly. And if you decide one way or the other, you can do that. And just to respond to Patrick, seals are mammals. They're not really fish. So they're red meat animals. So they are. You're still getting that. So. And then, the one thing on the Inuit, I'll just point this out because a lot of people will criticize Inuit and they'll say, well, they died relatively early. Their life expectancy is 66 now or something like that. But when we look at, when we compare them to other indigenous populations, And I think there is a problem with looking at modern indigenous populations relative to what they had access to 50, 100, 200,000 years ago when Homo sapiens first came in, is that despite the fact, and this is one of the reasons why we were forced to adopt agriculture and more plant-based food, is the animals got too damn skinny. When we ate all the fat ones, we were left with the skinny animals, and we had to supplement our energy with plants, and then eventually developing agriculture, to the demise of our health. As we saw, our brains got smaller, our skeleton got smaller, our skeleton became riddled with disease, our teeth got worse as we went from hunter-gatherers to full agriculturalists. So, yeah, that's it.
Excellent. Thank you, Shawn. Anthony.
Yeah, so I also wanted to make that same point. That we did evolve eating megafauna with quite a lot of fat, and when the megafauna started dying out, that's when you actually start noticing the fossil record that we started cooking and breaking the bones, the marrow bones, to get at the marrow to get it more fat. So we seem to have been quite aggressively seeking fat and that sort of energy source. And of course, nowadays we don't have that same access, which like Dr. Baker said, is why we have to look to other means to get the energy that we need. But that doesn't necessarily mean that that's what we're evolved to eat. That doesn't necessarily mean that that's what we're genetically designed to eat and what's optimal for us. Our genes as Homo sapiens have been quite stable for about 300,000 years. Obviously, there have been some changes, but it has been quite consistent overall during that time. I would make the point with DHA that really doesn't exist in its whole form. EPA or DHA don't exist in plant forms. You really do have to get it from animal sources. Some people say that ALA, you can convert that into DHA and EPA, but I think the studies on that are a bit mixed. And either way, if you can, it's a very, very low rate of transformation into these essential fatty acids. So I don't think you can exclude fat or sort of the fat from animal fat. Certainly that's one of the essential nutrients in animal source foods is the essential fatty acids such as DHA and EPA. And when you're contending with things in plants that, as I touched on in my talk, plants defend themselves by using chemical deterrents. All animals and plants have defenses. All life has defenses. And while animals can run away or fight back, plants can't. And so they use chemical defenses and deterrents to stop animals from predating on them. And so if you haven't evolved to eat a specific plant, then that plant can have toxins that you aren't capable of breaking down. So while we can certainly get nutrients and quite a lot of wonderful nutrients and vitamins and minerals and all these sorts of different things that can certainly help us, we are going to get the bad with the good. And a lot of those nutrients are not really as bioavailable as they are in meat. Some are not bioavailable at all. There was, the history of pellagra, which is a niacin deficiency. This killed millions of people around the world because they were eating so much corn that didn't have access to niacin. They were eating this to the exclusion of other things, and they were dying of pellagra, niacin deficiency. The irony there is that corn has a lot of niacin, and it's just bound up in ways that we cannot break down and access. And so that bioavailability is not there, and we can't access that. So these plants may have a lot of nutrients in them, but that doesn't necessarily mean that we can access them through our own native physiology, which means that we are not designed biologically to eat these things.
Excellent. Thank you. Dr. Chidi, can I ask your thoughts to follow that through? Again, sort of coming from the plant-based perspective you do, what's your thoughts on the diversity of people, how they respond to different plants, how you manage that, I guess, in a clinical setting?
Yeah, I mean, a lot has been said. I mean, talking about the Inuit, for example, going back to them, yes, it is true. They have a heavy meat-based diet, but yes, they don't live very long. They have more hip fractures than anybody at the age of 40. There's a reason why our body tends to break down if we're not getting everything that we need. And then when we talk about all these different minerals and nutrients, amino acids, I often hear this argument that, well, if you have a lump of steak in front of you, it's got the best bioavailability of amino acids, got all the amino acids, got all the nutrients. But you know what? It doesn't appear to me that our bodies were put together just to have one slab of meat. Yes, if you're just eating corn on its own, you're going to be deficient. But the beauty of life is having a rainbow of foods in front of you. When you put them all together, they somehow manage to keep us healthy. And that's key for me. What is it that keeps people healthy? Because it seems to me that the people that I treat, the people that I see, when they're on this healthy plant-based diet, they're not getting poisoned by the food they're eating. They're actually getting better. They're reversing their diseases. And that's just, I mean, forget about just my examples, but I mean, that is in the data. I mean, we talked about the China study and other studies. When people are on a healthy plant-based diet, they're doing well. Yes, I could say, like has been said before, well, you know, if eating plants was bad for you, and how would I be alive and how would I be? The body is a wonderful thing. I mean, I remember coming across a guy who ate very little other than chocolate and drank lots of beer. He looked perfectly healthy to me. But the body's able to do tremendous things, even when we're polluting them. The problem is it doesn't last long, as is in the case of the Inuit.
Excellent. Thank you very much. Andy, just to let you know, your hand's still up on that. I don't know if it's if probably don't know.
Well, I actually just I put it up again. If I had a chance to say one quick response to that. So we're talking about reversing diseases, and absolutely, you can have things that are worse than others, and you can put someone on something that gives a relative improvement. And absolutely, and I've seen that absolutely happen. I have patients that don't want to go onto a meat-based diet, maybe for religious reasons or whatever. I work with them to put them on a healthy, nutritious, plant-based diet, and they absolutely get better. The thing is, it's always compared to what? So if it's compared to a processed food diet, yes, this is going to be an improvement. If people are conscious about their health, they're going to have other sorts of improvements as well. They might not stop. They may stop drinking or smoking. They may start exercising. So there's that healthy user bias that can also come into play. They're making a lot of changes in their life that are improvements. I don't think that it's from removing meat that is causing that benefit per se, but the removal of all the other things and changes in the other aspects of their life as well. And in fact, I do see that putting people on a whole food meat-based diet coming from a whole food omnivorous diet, we are reversing different sorts of diseases as well. You see this in the literature with Crohn's disease in particular, where there was a study that showed that if you remove carbohydrates and fiber as compared to people who didn't, they stayed in remission on average up to 51 months, and that was without medications, and contrasted that with the other group that remained having sort of whole food, unprocessed fiber in their diets, unprocessed grains in their diets. They did not go into remission. They had stayed in remission on average 0 months. So we see that sort of thing as well. So there are it's all relative, and so you need to look at these things as compared to what. And I absolutely agree that you can improve someone's health significantly in those sorts of ways. But I think that if you're looking for optimal nutrition, I think you have to go to the ground floor and go back to just first principles. What kind of animal are we? What are we designed to eat? A lot of the studies with the Inuits, just to wrap up quickly, some of these things aren't looking at the Inuit living in their native pastures, as it were. Some of these people are actually living in, or there's just the ethnic community in general. And some of these are now, subverted by the ways of the West and start getting different sort of Western food and diets. It's actually used to be called the diseases of the West. People from Western countries would go to North America and Australia and elsewhere, and they found that people weren't getting these same diseases, these diseases of the West. But now they are all getting these diseases, and in fact, at a higher prevalence. And that was with the adoption, I would say, by a Western diet as well. And so some of these are possibly or going to be a bit convoluted because of those sorts of confounding factors. Are these people all living to their traditional ethnic ways and only exclusively eating seal meat and things like that? Or are they drinking alcohol, smoking cigarettes, and eating processed and refined carbs? So sometimes there are problems with those, and they usually say, but they don't always differentiate.
Thank you, Anthony. Shawn?
Well, I just wanted to tag on with the Inuit comment, because we all recognize smoking as a risk factor for cardiovascular disease and ultimate mortality. The Inuit smoke at a rate of about 70%. They have one of the highest smoking rates in the world. They start at average of age 8. And so when you're talking about Inuit health outcomes, you have to consider the fact that they smoke more than pretty much anyone else in the world. So you can't just pin that on diet alone, I think.
I think that's coming through as a really important point. We're looking at the epidemiological data to make sure you're teasing out where the real issue is. My live Q&A, I can't get to come up. So if there are questions coming through, maybe Olivia, if somebody could ping some questions in. I think we do need to touch on saturated fat, cholesterol, heart disease some more, because I think that came up as part of the discussion that does need teased out and can't be left where it was left. Do you want to?
Well, yeah, I mean, I totally agree that saturated fat and cholesterol have got nothing to do with heart disease, and they're perfectly good. I wrote my first book in 1981, so I'm, here the plant-based person. But there is no link between cholesterol and heart disease, and eating cholesterol-rich foods and heart disease. It's wrong. So I quite agree with that point. And the Inuit, by the way, let's not give them a hard time. Have you ever been 300 miles from the North Pole? It's a very, very hard place to live. I mean, the fact that they could live to 66 is just, quite incredible. But in case you don't know, what happened was Professor Hugh Sinclair from Cambridge went and lived with the Inuit, and they had the highest intake of cholesterol, the highest intake of saturated fat, and no heart disease. So he shipped their diet back with him to Cambridge, which was seal meat, ate it, and found that his blood thinned, his triglycerides fell, and everything else. So the Inuit were actually the proof that heart disease is not a function of eating high cholesterol and high saturated fat. So I think, my view, I think veganism is a mistake. Yeah. So at least on that point, I completely agree with the carnivores. I just wish that they were more fishivores.
Thank you, Patrick. Hayley, are you wanting to?
No, I just, when you didn't want to give the Inuits a hard time, you wanted to eat them a few minutes ago. I found that a little bit strange. The cholesterol, I think I get asked that quite a bit by my doctor colleagues who know about my daughter and the way that we eat. And, in Ireland, it's plant-based stuff it's growing, but it's not popular and it's not very common. And one of the biggest things that I get asked is about cholesterol and, saturated fats. And it's just, it's not anything that I really even enter into discussion on anymore, because I think it's been debunked so well now. The other thing was that medication that my daughter was on raised cholesterol. So it was a little bit of a battle with the hospital around that, how it was actually managed as a nice kind of, I suppose, bit of neutral ground was I added turmeric and cayenne pepper, which actually brought the cholesterol down to a level where the hospital were happy and I was happy, which wasn't in the boots, but it was a good compromise. And that was just done by managing plants after there was talk of statins. And, statins in kids is not a place you want to go.
It's really interesting. Thank you. Sure, Patrick.
Just a real short point. In case you don't know, it was Anichov in 1913 who fed rabbits a high meat diet, saturated fat, cholesterol, and found blockages in the arteries that kind of looked like, what we see. But the poor fellow didn't realize that rabbits are herbivores. They do not have the physiology for processing animal fat. So it was a complete mess up in terms of experiment. But the reason why we're banging on about cholesterol, let's face it, is very simply because there's a drug at the end of the line. So we have invented a new disease which is called hypercholesterolemia. And in case you haven't realized, we are in the process of inventing a new disease which is called high amyloid. And the reason is because there's a drug at the end of the curve and there's a need to make big profit. So just watch it, because it's the same story. Amyloid is not a cause. It's a consequence of dementia.
Thank you. I think we shouldn't let this idea pass around cholesterol and saturated fat being a problem, because I think out there in the world, people are really still focused on this. Every second patient is still concerned about that. Dr. Chidi, can I pull you in here again, coming from the plant-based world? And certainly some of the studies you were sharing, where's to help the public move on in some ways, help colleagues move, where's the thinking in the plant-based world around the role of cholesterol in heart disease and saturated fat?
Well, I think like most people have said, getting away from processed food, I think everybody's in agreement with that. Now, when all of you are saying, well, cholesterol's got nothing to do with heart disease, it's a strange thing, given that cholesterol's present in the arteries that clog up. And then I would also ask, well, what about the fact that if people are on a heavily plant-based diet or almost totally plant-based diet with low sugar, they don't seem to have lots of cholesterol in their system. Now, I'm not going to suggest that, well, that's the most important thing, having cholesterol and high meat intake, but there does seem to be some sort of link. And I would agree with Patrick when he talks about the statins, because when Dr. Anthony was talking about, well, when you lower cholesterol, heart disease went up. I mean, for most people, that sounds counterintuitive. How can that be? It is true, because how did they lower the cholesterol? They lower the cholesterol using statins, and statins do not improve outcome when it comes to heart disease. I know we're all being funneled into getting more statins, but it's simply not the case. If you are going to reduce the amount that you consume, that may have an effect. But just taking statins, it's not something that I recommend.
Okay, thank you, Shawn.
I think that serum cholesterol is a dependent variable in the development of heart disease, and it depends on what else is going on. So there's a lot of other things that are potentially modulating or modifying that. So I don't think we can just totally ignore it. When people come in and say my cholesterol is high, and I hear people say just ignore it, doesn't matter because you're on a low carbohydrate diet. I don't necessarily agree with that, but I do think that we talk about saturated fat and its role in raising cholesterol and it having a role in heart disease. And if you look at the U.S. diet, I mean, for instance, it was eye-opening to me that in the United States diet, 3% of our saturated fat comes from the beef we eat, which means most of the saturated fat we're consuming is coming in snack cakes and sandwiches and processed food. So again, it's another one of these things where you've got this villain, but it's actually part of a larger issue, which is again just the garbage diet we have. And I think we can all get away from that diet. We're going to be so much better for it.
Patrick?
There was a very good study looking at a bunch of people who'd had heart attacks and very closely at the whole cholesterol issue. And this is something that seems incredibly logical, but basically the bottom line was what they found was that it was glycosylated cholesterol that was by far the best predictor of heart attack, glycosylated cholesterol. We don't find cholesterol in atheromas. We find foam cells. What are foam cells? Foam cells are immune cells that are on the scout for things that don't look right, like a virus or a cancer cell, etc. And when they find a sugar-damaged, glycosylated not hemoglobin, we know about that, but a glycosylated lipoprotein, they gobble it up. And that's what you find in atheromas. Yes, they're full of cholesterol, but they're actually full of damaged cholesterol. So, yes, there is some statistical correlation with higher cholesterol and heart disease. Look, I went to my doctor. I'm 65. My cholesterol is 5.5. My triglyceride is 0.7. My HbA1c is 4.9. My HDLs are really high. And the guy says, you've got to go on statins. And I say, well, what is the numbers needed to treat the NNT for somebody at my age with no history of heart disease, low blood pressure, et cetera, et cetera? He said, good heavens, you don't expect me to know the NNT for all the drugs I've prescribed, do you? And I said, yes. And I'll tell you what the NNT is. It's pretty much close to infinity. So, why on earth we have a medical system that still relies on some fake formula calculator stuck in the nice guidelines that wants everyone to have statins? People are not dying from a lack of statins. They're dying from junk food and sugar.
Thank you, Patrick. It's a reflection and doing GP job and with colleagues. I think we should underline some of these statements because it does. The narrative in everyday practice is your cholesterol's high. Do you want a statin? You need to change what you eat. Off you go. Next, and as I think we were discussing, we've moved on from that probably decades ago. So we have 3 minutes left. I'm loath to open up to questions because in 3 minutes. But Sam, is there anything on the app, or Olivia, anything on the app that is important to get in there, or? Oh, sorry, Anthony, go for it.
Yeah, sorry. Just to tag on with everything, there are some studies, larger studies that sort of show, smaller increased relative risk with LDL, higher levels of LDL, but specifically with small dense lipoproteins. All the different sorts of particulate sizes in LDL obviously are different. So these are things that act differently in our body as well. And the ones that are glycated and damaged are tend to be these small dense lipoproteins, the pattern B LDL, and that even with the damaged LDL, increases your risk of heart disease relative risk by 1.7 times. Whereas metabolic syndrome increases by 6-fold and diabetes increases by 10-fold. And so these are things that are probably going to precipitate the increase in the amount of SD-LDL as well. So I think that is something that it sounds like we can all agree on. It is a much more better focus, is the metabolic health of our patients and not just looking at the cold number of cholesterol.
Excellent. Thank you very much. And I think that's probably a good point to wrap up on. We'll everyone have a final word, but I think we're hearing that there's a consensus, if it's allowed, is there is a moving away from the kind of the ultra processed food is clearly a good idea. There's clarity there coming through about we shouldn't just be looking at cholesterol, which has been well understood now for some time. And then there's certainly various preferences and looking at what happens to our body in the moment and if it works for us. Sam's waving at me.
Yeah. Thank you. So kind of one theme on the app is just, what's the relevance of evolution when it comes to our diets?
Right, we've got 5 more minutes.
Yeah,
brilliant.
Yeah, that's good.
I think there's been a lot that's been said that is not correct about evolution. First of all, Homo sapiens appears 100,000 years ago. It was way, way, way later that humanity learned how to hunt animals with spears in groups. Way, way, way later. So I think the really interesting question is, how did we become Homo sapiens in the first place? And I don't think it happened through a carnivore diet. And, a simple example, our oldest Homo sapiens in the Gower, Paviland man, 22% of their diet was marine food. What's easier, to go and hunt for an animal or to walk in our estuaries full of marine food, full of mussels and crustaceans and fish, which is what birds do, storks, So and this has to be an opinion because we're going back to prehistory, so it's terribly hard to prove. But if you look at the physiology of the brain, we could not evolve as Homo sapiens without an incredible supply of omega-3. We are 1.5% genetically different from other apes. So it was the environment that drove evolution. Then we have these periods of ice age and the younger Dias, which I think people now understand was a meteor strike when things got tough and people started to hunt large animals and all that sort of thing. But 40,000 years ago in Australia, we find grindstones for grinding grains seasonally. 30,000 years ago, we find Neanderthals with lentils stuck in their teeth. I knew these two professors of Paleolithic anthropology. One of them has died, the other one is Ivor Cummings, brilliant book. And they had the largest collection to ancient human feces. And the answer is twofold. One is it depended on where you lived, right? And two, human beings have always eaten a wide variety of foods. That's what they found in ancient feces: meat, nuts, seeds, fish, fruits, berries, and all the rest of it. So I would argue that we are an adaptive species, and we've adapted to interact with our environment. And I believe that we became human not just eating marine foods, but also eating fruits and vegetables, the easiest thing to get. I'm not saying, it's wrong to eat lots of meat, but if you do, make sure it's fit meat. And I just wanted to chuck that one in.
Thank you, Patrick. Sean?
Well, I think we've been hunting farther than 100,000 years ago, because there's clear evidence of tools, butchery marks going back 2 million years. And so, I mean, that's pretty well, I think, largely considered the consensus among most anthropologists and archaeologists. And so, also, again, the changing nature of the animals we hunted is extremely important. I mean, again, we had lots of fat, and you can get plenty of omega-3 from terrestrial animals, enough to power your brain. You don't need to necessarily eat fish. I'm not opposed to eating fish, and I think it's fine to do so, but I think there is ample evidence we hunted big animals for a very long time, even going back to Homo erectus 1.5 million years ago. So I just think that's what most of the evolutionary anthropologic science seems to show.
Thank you very much. Anthony?
Yeah, so I would just agree with Dr. Baker. I think there's quite a lot of information and evidence to the effect that we have been hunting, and in Dr. Bendor's studies, he shows a lot of this evidence as well, and there's quite a lot of others as well. But there's evidence of when we look at the Native Americans, they had the buffalo drops. They would scare a herd of buffalo over a cliff. You didn't have to hunt them with spears. You actually just scare them over a cliff. They would fall and die, and then you'd use stone tools to cut them up. We have evidence of this going back to the mammoths quite more than 100,000 years ago, quite a significant amount before that. So we didn't necessarily need to hunt them with spears. We had other means of hunting them and harvesting them. And as you say, there's evidence going back millions of years of stone tools. The first work stone tool is about 3.3 million years old, and is evidence of that stone tools cutting into bones in a way that'd be carving meat off that bone. And so obviously that would start as a scavenger, but we were eating meat and then eventually being able to hunt the meat. And then, during the Ice Ages or the Inuits now, there really weren't any plants available. And so, yes, there would be areas that you could eat other plants, and certainly people did. Anthropologically, you look at the Native Americans or the Native Australians, going back hundreds of years, they would predominantly eat meat. They were predominantly hunters, but they absolutely knew which plants they could eat if they needed to medicinally, or if they weren't getting enough food as well. But there seemed to be a preference for meat, and certainly in certain areas, there wasn't the option of having plants. And some people say, well, when the ice ages were coming down, people were moving more towards the equator. But in fact, that's actually the opposite of what the fossil record shows. The fossil record shows when the ice sheets were coming down, our ancestors were actually moving up into the ice shelves, likely because that's where our preferred game was, the megafauna. And so I think that it absolutely is important to look at our evolutionary background and see what our ancestors were doing, and see what we're biologically adapted for, because I think that is what this comes down to. Just like every other animal, we have a biologically appropriate and designed and adapted diet, and we are adaptable. We absolutely are adaptable, and that confers a significant survival advantage to all of us. That if we don't have our optimal diet, that we can still survive on a suboptimal diet. Whereas like a lion, they really have to eat meat. Maybe they can eat some other things, but generally they try to eat other plants. They're not going to make it, and we have that ability, and that gives us a survival advantage. But when we're talking about what's optimal, what is the best you can do if you have everything available to you, I think that eating at least predominantly meat is a better avenue.
Excellent, thank you very much, Dr. Chidi. Hayley, would you like to add anything to that?
Yes, well, I think going back into evolution hundreds of thousands or millions of years ago, yeah, it does have some benefit, but we're still doing a lot of supposition and guesswork. I'd rather look at what is. I mean, when we talk about our actual human anatomy, look at the way that our gastrointestinal tract is designed. Yeah, it is designed. It's long, like most herbivores. It is not short, like most of the carnivores. There's some kind of a design factor around it. I don't think it's just, well, if you want to eat plants on top of it, it's okay. But we seem to be designed to eat plants as well, at least as well. I think those people who are advocating meat exclusively can see that, well, look, the way our bowels are even designed is to enable us to digest and extract all the nutrients from plant material too. But look, I've had a good discussion. I've enjoyed it. Thank you very much.
Thank you. It's what a privilege to host this panel. I think part of the public health collaboration task is ensuring there is diversity of scientific debate, which other parts of the world and topics try to shut down. So it's been fantastic to have you all on board with that. Dr. Anthony Chaffee, thank you very much for joining us from Australia. I've just dawned on me. I hope you've got a lie in. I hope you've got time for a bit of a sleep, because it is in the early hours for you. So to look so fresh because of that is fantastic. Dr. Chidi, thank you so much indeed for your being able to join us and be part of this discussion. It's been so useful to hear the diversity of thought here. Dr. Hayley Wood, again, thank you so much for arriving at such early hours and sharing the powerful stories and just remembering the importance of this. It all relates to human life and our health that we live every day. Patrick Holford, I think you need to put on that 3-day workshop because there's a lot more questions that I have in here to be answered. And Dr. Shawn Baker, as ever, thank you so much for your detailed information and your clarity of thought with it all. Thank you.